Hi, thanks for coming back. So in continuing with our educational program about the cervical spine, I wanted to just go over a quick overview of what we talked about last time, which was the anatomy of the spine. And again, the anatomy is it's composed of bones and discs in between the bones. And again, right behind the disc comes a nerve. The nerves are, again, those electrical wires that go down our arms and allow us to have motor ability as well as sensation in our arms. When a nerve is pinched, we get that syndrome called radiculopathy, which we spoke about last time, or numbness, burning, shooting down the nerve, as well as weakness in the arm. So what we're going to talk about this week is what can you do about it? And basically, our first thought with taking care of the cervical spine is surgery last, everything else first. Many patients do not require surgery, even though they come into our office thinking that's going to be their only option. We have many non-operative therapies that are extremely effective, and most of our patients get better without ever seeing a surgical operating room. What can we do non-surgically in order to treat our patients? First of all, we always recommend a period of rest from whatever aggravating factors cause the problem, and we typically start a short course of anti-inflammatory medication, which could involve something like Advil or Motrin, and more potently, a Medrol dose pack, which is a short course of steroids that can really break down the inflammation. Next, we move towards something that is more consistent with physical therapy. We order physical therapy because it could be very effective in taking the pressure off a nerve that's been pinched by a disc herniation. What the therapist would do with a patient of this nature would be to start with some stretching exercises, to start with some mechanical massage of the area in order to loosen up the muscle spasms, and some cervical traction. Cervical traction places your neck in a machine that pulls on the neck, separating the disc, and as you can see, making more room for the nerves by improving the opening for the nerve. This done over a period of time could eventually unpinch a nerve and reduce the shooting pain, weakness, and numbness that you may experience down your arm, and start to make things feel better more permanently. Some strengthening exercises that a therapist will teach you can keep it better afterwards. Once again, surgery last, everything else first, and these treatments are typically very effective for non-operative care. One last non-operative treatment that could be offered to a patient with a pinched nerve is an injection. We typically prefer to put the injection directly on the nerve. This is done safely with the use of an X-ray device that allows our interventional specialist to place some medicine directly on the nerve where it's being pinched. That shrinks the swelling in the nerve, can give some excellent temporary relief, and hopefully a long-term sustained effect. Thank you. We'll talk more about the neck next week.